Hi, my name is Andrew Childress. I'm the Assistant Director of the Humanities Expression and Arts Lab, also known as HEAL, here at Baylor College of Medicine. We recognized that there was kind of a focus on basic science, but not a lot of focus on the human side of medicine. So we wanted to bring in the arts and the humanities so that students and others can connect to their patients as people. So I think what's important is that physicians see patients as people who have internal lives, who have stories that they want to share. And it's important to connect with them and make them feel that they matter, that their illness matters, and that they're not alone.
HEAL's mission is to make medicine more human. The history of medicine is that it's built on the arts and humanities. From the time of the Greeks, Hippocrates and Galen, they saw it as an art. And so HEAL really tries to bring that back into modern medicine for the benefit of not only the patient, but also the practitioner.
At the end of the day, we're treating people and they exist in a larger cultural context, and so getting a chance to look at a beautiful piece of art and talk about how that makes you feel increases your ability to be able to communicate effectively, and that is such a vital skill, I think, in any field, but definitely in medicine.
We try to give them clinical scenarios where what they're reading from a book or what they see in art makes the difference at the bedside.
Whenever you look at a work of art, I might see one thing, you might see something else, a third person sees a little detail that nobody else noticed. Sometimes I can really widen your perspective. You might have to learn from different people and see how they see the situation, and then that can really inform how you see it in the end. And I think that is very applicable to medicine, which has a lot of gray area. Sometimes there is no right answer, and you do need to have that collaborative mindset with different perspectives.
There are multiple interpretations for any work of art you've ever seen in your life. And that requires being able to tolerate the ambiguity and the uncertainty and work within that world and allow yourself to be vulnerable to that work of art in a way that prepares you to be vulnerable for the complexity and the chaos that you're confronted with when a patient comes in.
When I get to treat a patient over weeks and get to know them and their families and get a sense of what this snapshot of their life is and their overall story, that is when I'm able to use some of the things I've learned from HEAL to appreciate my role in that patient's care.
It's a long career, and we should care about it because everything that you do at the hospital or in a clinic, you have to integrate that into an architecture of meaning for yourself.
There's a big world in which we all live in, and it's important that you stay connected to that and connected to who you are. It's not just about science, it's not just about really important research around curing disease, it's about actually healing the whole person.